Welcome to LECOM Health Matters. Our guest today is Dr. Elizabeth Johnson. She's the pharmacy manager at the Senior Living Center for LECOM. And Elizabeth, welcome.
Thank you for having me, Monsignor Rubino.
Thank you for being here today. Pharmacists are busy. I read somewhere that there's something like 8 billion prescriptions prescribed a year. Can you tell us a little bit, because this is Pharmacy Month, where we celebrate you, the pharmacist, and all the good work that you do. Can you tell us a bit about how the role of the pharmacist has developed over the years? Because most of us remember when we went to a drugstore and they gave you a package of pills and out you went.
Yes.
And it's very different now in terms of the education component, in terms of the advice component. Can you talk a little bit about how that has changed the role of the pharmacist that you do so very well?
So when I started in pharmacy in 2005, it was a completely different environment. It was more about just medication delivery to the patient, filling prescriptions and getting them to the patient. As it has progressed through the years, they've noticed that pharmacists are a very accessible medical professional. So you find many corner stores that have a pharmacist 24/7. So they have we've adapted to that and changed our roles. So now we do immunizations. That started prior to COVID, that you would go to the drugstore to get your influenza vaccine or your pneumonia vaccine. And then as the pandemic hit, we became a very key player in helping immunize the mass population. We also help at this facility in long-term care. We discuss many things with the physicians for the patients to better patients' medication management, be it things that they need to be taking that aren't, or things that they are taking that they don't need to. So we really criticize their med lists and make sure that everything is on there that should be on there. It's dosed appropriately. So we're now a more intricate part of medication management as far as our whole role, and less of just medication delivery.
In terms of medication management, for the people that are going to be listening and watching this, when they go to their chain pharmacy, their retail pharmacy, or wherever they go, CVS, Walgreens, whatever it might be, should they feel comfortable asking the pharmacist about what they're receiving, what its potential side effects might be, and more importantly, how it interacts with whatever else they're taking?
Absolutely. So on the back end of that, before the medication is ever dispensed to the patient, put in a bag for the patient to pick up, the pharmacist would do all of those interaction checks through a computer system. We also know how to check for appropriate dosing for a specific patient population. But most of our interaction checks only work if the med was filled at the pharmacy you're at. The problem we run into is when patients fill prescriptions at multiple pharmacies, that we don't necessarily see all of their meds. So it is very reasonable for you to ask your pharmacist if there's something that you fill, or even over-the-counter medications, because there are a lot of over-the-counter medications that have interactions that people don't realize.
Well, that clearly underscores the role of the pharmacy educator. But let me take you back for 1 second, because I think you said something that's really very interesting that I didn't know. So if I go to my local, we'll use Rite Aid, for example, and when I pick up my bag, whatever might be in that bag, or if I go to my own LECOM pharmacy, which we have, I know, because I go there consistently, that somebody there is checking the medications and the interactions and the appropriate dosages.
Correct.
Whereas if I start bouncing around, I lose that advantage, and that could
Correct.
Potentially be problematic.
Oh, absolutely. It can be life up to and including life threatening. So that, for example, if you go to the ER, if you fall and go to the ER and get a pain medication filled at a 24-hour store that's not Colonial Family Pharmacy, they can only check as much of the information as they have. So they wouldn't necessarily have your entire med list. Mm-hmm. So yes, it is very important for you to keep a copy of your med list at all times on your person, so that if you do end up at a off the wall pharmacy or out of town and something happens, they're not going to have your medical records, but then they can still run a comprehensive check
Well, I
for
think
your
that point
current
is
med list.
critically important because I don't think people realize what you just said, that going to a pharmacy consistently, the same one
Mhm.
as Colonial Pharmacy, which is the LECOM Pharmacy,
Correct.
they have your med list and they're
Mhm.
checking to make sure, because
Yeah.
people go to different physicians, people go to different
Oh,
doctors,
absolutely.
especially as they age, and they see a lot of different
Mhm.
providers that sometimes there could be a conflict. You miss out on that benefit
Correct.
if you're bouncing around looking for the cheapest pharmacy you
Correct.
can find or
Correct.
looking for the best deal that you can find.
Correct.
You may not get that. Well, that clearly plays then into that role of why we celebrate Pharmacy Month, because your role as an educator, you're far more than just a prescription filler.
Oh,
You're
absolutely.
there to educate people. And does the training provide you that opportunity to do that?
Yes. So prior to, don't quote me on the date, I want to say late 1990s, you could have a bachelor's of pharmacy and still practice as a pharmacist. Then they noticed that the education needed to be more in depth. So now anyone that practices pharmacy, except for those licensed prior to that cutoff that were grandfathered in, have to get a PharmD. So we actually have a doctorate of pharmacy. That's the only option you have to be a practicing pharmacist. So we have an equivalent amount of training to a physician or a podiatrist or a physical therapist. So we go through, at best, 6 years. If you play your cards right with the accelerated program at LECOM, you can do 6 years. But
or 7 if you decide to go to Florida.
Exactly, 7. But there are some pharmacy schools that make you do 4 years of undergrad and 4 years of graduate school. So if you're not in an accelerated program, you can be working in upwards of 8 years of education.
And what's the difference between what you do here at the senior living facility and the chain pharmacists do at the retail pharmacies?
So we focus a lot more on transitions of care. So we have our long-term patients that we monitor and we check all of their medications. But our transitions of care is a big focus of the Senior Living Center pharmacy. So patients that have gone to the hospital for a heart attack or a stroke come to us for rehab and then get discharged back into the community to make sure that their med list, nothing gets accidentally omitted from a med list or nothing gets added, that they don't have any interactions with new meds for their cardiac condition or pain meds, so that they can be discharged safely back into the community and have the best outcomes once they go back out into the community.
So at our LECOM facilities, people can feel comfortable knowing that, God willing, when they are discharged and ready to go home, their medicines have been reviewed
Correct.
by the physician, reviewed by the pharmacist.
Yes.
The appropriate dosages
Mm-hmm.
are there for them to understand so they can go home comfortably knowing that they're taking the right medication at the right time.
Correct.
I hate to ask this, but I have to ask this because it's a question of cost. If I go on the internet, I can buy a lot of stuff.
Correct.
Bad or good?
That's it. When it comes to pharmaceuticals, there's a very stringent process developed by the FDA to make sure that medications are safe and that they can be taken without fear of repercussion. Some of the stuff on the internet that you can find can come from places that would not be regulated by the FDA. I would be very hesitant to just go and purchase things online. If it's over-the-counter stuff, multivitamins, Tylenol, things of that nature, I'd be less concerned. But your prescription medications that we give at a pharmacy, I would be very hesitant to purchase unless it was through someone that is regulated as well by the FDA, such as an insurance company. You can buy a 90-day supply and get it mail ordered. That is perfectly fine. It's going to be searching and buying things from Canada because they're cheaper, or buying things from overseas because they're cheaper. I can't say with 100% certainty that they're going to be safe.
Well,
and effective.
No one can, but the point of the matter is, you're right, the over-the-counter stuff, if I go buy Tylenol or whatever, that's different. But if you go on the internet, you can buy so much.
Yeah.
Someone once told me that you really don't know what's in the bottle.
Right.
Or
right.
how
You
it's
don't know what you're
manufactured.
getting.
And they laughed at me when I said that. I said, well, if it's no disrespect to anybody or any manufacturer, but if I'm buying something and the price differential is so much, am I sure that what's in that bottle is the correct formulation? And as you said, does it interact with self-prescription?
Right.
Self-prescribing is not a healthy thing to do.
Correct.
Using the internet.
And the other concern that comes with any sort of mailing or shipping of pharmaceuticals is how that pharmaceutical was stored. Because most of the prescription and over-the-counter drugs have a certain storage requirement. Most of them are controlled room temperature. I don't know if you've ever been in the shipping part of an airplane or a UPS truck. It can get really cold or really hot.
Sometimes it gets really cold in the airplane too.
Yes. And that can be a fear. That can be a concern when you talk about shipping a pharmaceutical, that you don't know how it was stored. If it was shipped from overseas and is shipped over here on an airplane or a boat, that can be a concern as well, that it was stored properly and that did not affect the...
Well, when you stop and think of it, you're right. If it's shipped from overseas, if it sits on a dock in New York on a hot day for Lord knows how long before it clears customs, you really don't know what you're getting. And it's not to say that we're trying to discourage people from being educated consumers.
Absolutely.
But it's a safety issue.
Exactly. Absolutely. Because that heat can degrade any medication. So what you think you're getting a 50 milligram dose after it sat on that dock in New York, you could only be getting a 25 milligram dose, which may not be effective for you.
As we said at the top of this is Pharmacy Month, where we celebrate you. Thank you for all you and your pharmacists do to keep everybody healthy and well. But what would you say to someone who is listening or watching this, who's considering a pharmacy career? Because I think there are so many options within I think when people think of pharmacists, they think of the LECOM pharmacy and the good folks that work behind the counter. They don't know that there are other options to pursue.
So many options. So there are endless opportunities. We need people in research and development. We need people in nuclear medicine, which a lot of folks don't even realize that there is a pharmacist that measures nuclear medicine.
I didn't know that.
Yeah. So any of your nuclear, like a stress test or any of your PET scans for cancer, that is measured by a pharmacist and dispensed by a pharmacist. Compounding pharmacy, retail pharmacy, long-term care, hospital, there are endless opportunities. And I would strongly suggest someone do their research. If they enjoy manipulation, maybe research and development is better for them. And that is a very critical part of pharmacy.
The job market is good.
Yes. You can find a job in various fields.
Fairly easily, too,
Yes.
from what I understand.
Yes.
And also, I think that the hours can be somewhat more flexible, too.
Yeah, depending on what field you want to go in, absolutely.
The LECOM obviously has pharmacy school in Erie, a pharmacy school in Florida. And if anybody's listening and they're interested in pursuing that, our admissions folks would be very happy to work with you and go through, because the curriculum's the same. You got to get your PharmD before you do anything.
Correct.
And then once you get your PharmD, if someone is going to go into a specialty after they get their Pharm degree, they would do a fellowship or a residency to study A, B, and C, whatever that is.
Correct.
So it's a good career for people to look into.
Oh, absolutely.
But it is a career that clearly demands people being sensitive to people's needs.
Oh, absolutely.
And
some more than others. So anyone that would have interactions with the public. So our type of facility, a retail pharmacy, absolutely. Less so for a nuclear pharmacy because they do everything behind the scenes that people don't even realize they're there.
Just a few other final points. Now that we're into flu and COVID season, if I went to my retail pharmacist or if I went to the LECOM pharmacy, could I get shot there?
Oh, absolutely.
I could.
Yes.
A flu shot and a COVID shot?
I do not know about the COVID vaccines.
They're just coming on.
They are just we just got them last week. So do not quote me on the availability of COVID vaccines, flu vaccines, pneumonia vaccines. Some pharmacies even have things like hepatitis, the RSV vaccine. The Colonial has, I don't know that they have hepatitis, but they have RSV, pneumonia, and flu for sure, which for the elderly population, those are all indicated.
Just one quick question. When you said for the elderly population, if I'm over 60 and I'm listening, what should I get?
You should talk
Everything.
to your pharmacist or your physician based on what you have already received, and everyone should get a flu shot. There are very few people who would not be eligible for a flu shot, but they have developed new pneumonia vaccines. So pretty much everyone who has already gotten a pneumonia vaccine can still get a booster of the new pneumonia vaccine. The RSV vaccine is brand new, and I would suggest that to anyone because that can be dangerous not only for the elderly, but for our very young population. And the vaccine is for the elderly.
Could you describe the RSV vaccine? Because I think there's a lot of confusion.
So the RSV vaccine is for the lung virus, and the people who are exceptionally susceptible to it are the young population, newborns, and then the elderly population, because there is no treatment. It's a virus. You just kind of have to let it run its course. And a lot of the patients in that population don't have the physical strength to get through that vaccine. You're middle aged, so I would say probably adolescent, maybe 5 to 6 years old, the whole way up to 65. They get it and they don't even realize they have it. It's just a little tickle, sometimes a little bit of a cough, but nothing, just a normal fall cold. Whereas your young and your elderly can get hospitalized, horrendous cases of viral pneumonia and things like that can be very dangerous.
Well, to our point, though, we don't want to give medical advice over here individually, but their local pharmacists can walk them through
Absolutely.
What they should get and
Absolutely.
when they should get it and how they should get it.
Absolutely.
So again, happy Pharmacy Month, Elizabeth.
Thank you.
And we thank you and the pharmacists for all you do to keep us all educated as well as properly taking the medications that we're prescribed to take. This has been Monsignor Rubino for LECOM Health Matters. Thank you, Elizabeth, for being with us. Have a great day.
You too.